Today, we are excited to welcome Liam Haggerty with the Cleveland Department of Public Health. Liam found his way into street outreach as a volunteer, launching the St. Edward High School Labra Ministry while working at the school. Every week, he led students and alumni into the city, not just to pass out food and supplies, but to build relationships with those living outdoors. His commitment to service grew from there. He established St. Ed's monthly food pantry and fresh produce distribution, ensuring families had access to essentials. But the pull towards full-time homeless services became impossible to ignore. After more than a decade at St. Ed's, Liam stepped fully into the work in 2021, joining the Northeast Ohio Coalition for the Homeless as the Director of Street Outreach. In that role, he helped expand the organization's leadership in the HOPWA program, working to connect people living with HIV and AIDS to shelter and stable housing. In 2024, he took on a new challenge, serving as project manager for the Home for Every Neighbor initiative within the Cleveland Department of Public Health and the Mayor's Office. Under his leadership, the program reached its 18-month goal in just 6 months, and we are excited to learn more about that today. Liam is grateful every day to be a part of this work, and more than anything, he is inspired by the strength and resilience of the unhoused community and honored to stand alongside them. And we are honored to have him here today. Liam, I turn it over to you.
Hey, thanks, Rachel. Thanks for that introduction, and thanks for having me. Really excited to be a part. I've attended in the past, and so excited to get a chance to share about the work that my team's had a chance to do over the last couple of years. So, as Rachel said, I'm Liam Haggerty. I work for the Department of Public Health. I use he/him pronouns, and I lead the Home for Every Neighbor program. I'm going to share my screen and kind of dive right in. Okay, perfect. So, going to take us back a few years to the winter of 23-24. And for folks who work downtown or spend any time downtown or really spend time throughout the city of Cleveland, you may remember, Cleveland, like most metro areas around the country during this time, was seeing a surge in homelessness and especially unsheltered homelessness. There were sites on Payne Avenue and Superior and highway exit ramps, and there was a large site out in West Park near the Rapid Station, really all over the city. And, I do want to just take a quick moment before talking about our program, just in terms of some terminology. Unsheltered homelessness, meaning folks who are unhoused, but are also not staying in a homeless shelter overnight. So these are folks who are sleeping in a tent, sleeping in their vehicles, sleeping in a bus stop or a train station or an abandoned building, any place that's not meant for human habitation. And, there's lots of reasons why folks are unsheltered. People can't bring their pets to a homeless shelter. A man and a woman that are in a relationship together would have to separate to go to shelter, one to the men's shelter, one to the women's shelter. Folks with severe and persistent mental illness, maybe the congregate setting of a shelter is traumatic, or maybe they just have past trauma from being assaulted or having their things stolen at a shelter, or just the fear of that. They also may be LGBTQ. And again, I mentioned our shelter system is on a binary. And so for some folks, that just really isn't a viable and safe option. But ultimately, the bigger point is that folks who are outside feel safer outside, and their access point to services, including housing, is not going to be a shelter. So in this context, in February of 2024, the city announced a Home for Every Neighbor as an initiative to house 150 people by sometime in 2026. This was the vision and the leadership of Mayor Bibb that made this happen. It was February of 2024 where a press conference was held to launch the program. Executive Ronayne was there as well, showing that this was in line with the Cuyahoga County's Office of Homeless Services strategic plan to end unsheltered homelessness. And Councilwoman House Jones was there. This was an initiative that was backed by City Council as well. And so an RFP was issued just to say, here's the funds and how are we best going to solve this problem? Ultimately, it took us until June of 2024. I joined the city in May of 24. So we hosted some planning workshops with partners across the continuum of care, system partners, to say, how would we develop the Cleveland model to house folks who are unsheltered? Different cities have different approaches. We wanted this to reflect the expertise and knowledge of our community, and also to be in line with Cleveland's values. So we created a workflow and we launched a pilot in July of 2024. We worked at two sites at that time. There was some folks living in tents behind the Westside Catholic Center at 32nd and Lorraine, and then there were folks down at Canal Basin Park. So there were 12 people among those two sites, and it took us 6 weeks, maybe a little more than 6 weeks, but we were able to house all 12 of those folks and close those two sites. But after the pilot, we kind of reevaluated our approach, kind of looked at who our partners were, put our full team together, and then fully launched the program really about mid to late August of 2024. And by the end of September, we had housed 35 more people. In October, we housed 21 people, in November, 22 people, and in December, 25. And so, as Rachel mentioned at the beginning, we set a goal of housing 150 people in 18 months. We were able to house about 150 in just over 6 months. So we were able to move quickly and efficiently to get people into housing, which is really the appropriate response when we're talking about people living outside, especially in a place like Cleveland, which has winters like we're used to. I want to just talk real briefly as an overview about how the program works. So Home for Every Neighbor, my role as the project manager is leading all of these different teams that then work together collaboratively to quickly house people directly from the street. So we have an outreach team, and I'll kind of just walk through one site and what that looks like. So our outreach team and I will go to a site that we're working at that we've picked as a Home for Every Neighbor site. And we will spend a few days in the mornings passing out water and humanitarian aid and just learning who is living there. Who are the people that are regular stayers at this site? And after 3, 4, 5, depending on how many days and how many people are there, that determines how many days it will take. We come up with a list of these are the 12 people that we believe are staying here every night, or these are the 10, or these are the 4, or these are the 25. So we make that list, and then those are the people we're committed to housing through Home for Every Neighbor. So then I talk to each person at the site, explain the reason we've been coming here every day is the city has a program, and we want everyone who's unsheltered in the city to have access to housing. Are you interested in housing? And without fail, everyone says yes. And so our outreach team begins doing intake, learning a little bit about the folks. The most important thing they're learning is what type of unit do they need? We want folks to define their household. So are they a single adult? Are they a couple? Are they a pair of friends or a group of 3 friends that want to stay together and live together? Do they have children who maybe they could reunite with once they were back into housing? Do they have pets? And whatever that information is, the unit acquisition team then goes out into the community and finds landlords that are willing to participate in our program and have units that meet those needs. It's at that time that the case managers meet their participants at the site. Again, all of this is happening at the campsite. The case managers will be with them throughout the entire program, and they are the ones who then offer these units to the participants, saying, you were interested in a 1-bedroom that's pet friendly, that's on the first floor because of your mobility issues. Here's some 1-bedrooms that fit those needs. Are you interested in any of them? The participants select a unit. We help them apply. And then once they are approved, and if they are not approved, we just keep working to find another unit. Once they are approved, we do an inspection to make sure it passes some housing standards. And then we move them in. We have a team that does the move-ins, fully furnishes the apartments, and typically at a site with multiple people, we try to move everybody in on the same day. So there are sites where we had 8, 10, 12 people all moving from the encampment to their site on the same day. It's at that point the subsidy starts getting paid by that team. We also have a flex fund that just kind of helps with some ancillary costs. For example, someone gets in a lease, but at a previous time in their life, they didn't pay their utility bill for whatever reason. So they have a balance and the power can't get turned on until that gets paid. We'll use the flex fund for that. And then we clean up the site. So, that's kind of start to finish a visual for it, which I'm not going to go through this besides to just put this up on the screen as an illustration of just how many components are part of this work. Each one of those boxes is color coded to a different team that does the work. All of these steps happen for every single person that gets into housing through this program, and they all happen very quickly and sometimes simultaneously. I think a better way to provide a visual of the work is this picture here, or these pair of pictures. So this is a site underneath the Abbey Road Bridge by Scranton, for those familiar with sort of the Tremont near West Side, near South Side part of the city. There were 25 people living under this bridge. And so the site looked like the picture on the left when we came there. Um, it took us about 3 weeks. And in 3 weeks, all 25 of those people moved into housing, and then the site was cleaned up. And so that is what, Home for Every Neighbor does at every site that we work at. As I said, we have housed, well, I'll get into numbers in just a second. But so when we do house folks, we move them into a unit, we give them 12 months of a subsidy to pay their rent. And we have case managers that work with them intensely to get them connected to services. But again, we lead with housing. So it's always about, we want to get you into housing, and then we believe that those other programs and other services come next. In terms of what our overall numbers are today, and we're actually moving someone in today, so we're still very much working. We've housed 199 people directly from the street through this program. We've worked at 64 campsites throughout the city of Cleveland, and we've gone, we have worked in all but one of the city's wards at this point in time. So we have housed folks from all over the city. As you can see, we're housing people this spring, and now that we're into the month of June, I said we're moving someone in today. We have another handful of folks scheduled to move in by the end of the week. The average time it takes us to move someone in from that date of intake that I mentioned when we first go to a site is 11 calendar days. So we work to get people into housing quickly, believing that homelessness is a crisis and we should end that as quickly as we can. Just some other data points, and I won't read them all, but it is important to point out that 75% of the people that we've housed have been homeless for a year or longer prior to the start of this program. So again, these are folks who did not have a housing resource that was working for them prior to the creation of a Home for Every Neighbor. As you can see, a significant number of our participants have been connected to, vital documents that help them access other resources, connected to medical and mental health care, peer support, treatment, signed up for medical insurance, which again is not just a pathway to go to the doctor, it's a pathway to so many other things. And then in terms of long-term outcomes, 35% of our folks have transferred to a permanent voucher. So they're in our program to quickly get off the street. And then we connect them to a long-term housing support. Many others have transferred to solutions like moving in with family or paying their own rent or getting into some other subsidized unit. And at this point, only 8% of people who have left our program have actually returned to homelessness. So we're feeling confident that this has become a pathway for people staying housed. Just in closing, before I kind of hand it over to some questions, and I'd be happy to talk with any questions folks have, I just want to highlight a couple things about what we are committed to at the city and why we believe this program works. So the first thing is this is a housing program. I said, when I go to sites, I offer to people housing. There are cities in this state, and there are certainly states and other cities in this country where the response to homelessness is to criminalize folks, to clear encampments, to displace people, to threaten arrest, to arrest folks. In fact, when we were starting this program, we had a consultant we were working with, and one of the things they suggested is when you go to the sites, you will need to tell folks that if they don't accept housing, that they could be cited for trespassing, that they could be displaced. And that was something we as a group in that workshop said we were not going to do, that we were going to do this by just simply offering housing. And I think we've shown that that works. 99% of the people we have worked with have accepted housing. And I always say accepted housing so far, because those two people, we still want to get into housing. We're still going to try to find them again if they've left the place where they were before. And we've had examples of people who were at one site, said no, we found them at another site, and then moved them in from that site. Going along with that, we're person-centered. We find units that meet people's needs. That picture there is a picture of Jason and Terry. They're one of the first people we housed. They were behind the Westside Catholic Center. They were a couple that didn't want to split up to go to shelter. They were a couple that didn't want to split up to get into housing. They each had qualified for single person housing, but they didn't want to be housed as a single adult. They wanted to be housed together. And so we housed them through our program. They are still housed today, not on our program anymore, but on another subsidy. We housed recently a woman and her adult son and their dog. There aren't a lot of housing programs that will house an adult who has an adult child that she's not the guardian of and also has a pet. But Home for Every Neighbor was able to house them. I think we've housed almost 40 different dogs so far through this program, and some cats and some other pets. And then, we also recently housed two adult men that were friends. One of them had a significant mobility challenge. He would get around in a motorized wheelchair. They were friends, and at the campsite, they helped each other out because the one person couldn't get everywhere because of his mobility issues. So when we came to them, we talked to them about what type of unit they would need, they requested to live together so that they could continue to support each other. So the person without the mobility challenges could help the person that had those challenges. Again, that's being person centered, and that's how I think we're able to be successful in getting people into housing. And then finally, I was talking to Tony Richardson from the Gun Foundation about our program at an event last week. And he said, what you do is you get to yes. You don't stop working at that site until you get everyone housed. And I think that's our commitment. As I said, we have a list of folks we're going to house, and we don't leave that site. We don't close that site until everyone has a place that they're going to go. And it's not to another tent at another site, it's to a unit. And I'd be remiss if I didn't talk about the fact that this is, a team effort. So as I mentioned, we have all of these different teams. Some of the teams are made up of Department of Public Health employees. We also have a great partnership with I'm in Ministry, which is the organization that provides furniture for every one of our units, and they do that free of charge. So, we get free furniture for every person in the program. Downtown Cleveland Alliance has been our subsidy administrator from the beginning. The Northeast Ohio Coalition for the Homeless provides outreach support as well as case management support. And then when it comes to cleaning up sites, it's the Department of Public Works and the Department of Parks and Recreation, depending on where the site is. We've also, I should say the program is funded by the City of Cleveland's general fund, so it's in the budget of the Department of Public Health. But we've also had some very generous philanthropic support. The Rocket Community Fund, the Old Stone Church, which is now First Presbyterian Church, the Nord Foundation, Westfield Insurance Foundation. We've also had a very generous anonymous donor who has given to the program. And then we've also had just volunteers that have helped. So every time a participant moves into their unit, in addition to furniture and dishware and towels and a can opener, everything you need, they get a bag of non-perishable groceries that was packed by students from St. Ed's, and they get a bag of hygiene items that was packed by students from St. Ignatius. And both of those student groups, as my intro, as Rachel said in my intro, I used to work taking students out to sites. And so, we reached out to both of those schools because both of those schools have programs where they visit encampments. And students were saying, hey, we're not seeing folks at the encampments anymore. And it's because they're in housing, which is a good thing, but we'd like to still be helpful. We'd like to still be connected. And so that's a way they were able to stay connected to the work. So again, that's a little bit of a brief overview of the program. Again, really excited to have a chance to share with you today. I've got my contact information there. I know we do have some time for questions, but I also would be happy to answer any and all questions y'all have at the moment. And thanks for the opportunity to be here.
Liam, thank you so much. Let's go ahead and jump in. You talked about this idea of getting people to yes. What have been some successful strategies you and your team have used to get folks to yes?
Yeah, I appreciate that question. I think that what has made this program successful is that, I firmly believe, and housing advocates and homeless advocates believe that everyone wants housing. There is this narrative sometimes that folks don't want shelter, they don't want to be housed, they would prefer to be outside. And I just firmly believe that that is not true. I think the challenge is that some of the programs that exist haven't yet offered a solution that meets that person's needs. So, we were just working the other day with a couple and their dog, and one of the woman, it was a man and a woman. The woman was slotted for a permanent housing solution, but it was a single adult permanent housing solution. So their solution was she was going to go into housing permanently, and he was going to continue to live in the car with his dog. And, they were willing to do that because he wanted her to at least have housing. But ultimately, we were then able to say, we can house all three of you together in the same apartment. You don't have to separate your family. You don't have to get away, get rid of your dog, which for those who have pets, your dog's your family as well. And so I think a big part of it is just trying to meet folks where they're at. There is sometimes some hesitation because people who are unsheltered typically have been homeless a long time and maybe have seen the system not work for them in the past. And so there are folks sometimes when we first come that say, people have told me about housing before. I'm okay. I'll work it out. But then that first day that some folks from that site move in, we'll often see come up and say, hey, I'd like to do that intake now. because now I see that you weren't just, making up a story. You weren't promising me something that wasn't going to happen. So, I think it's about being consistent, about showing up, and then about meeting people where they're at.
Given your long career with working with the unhoused population, what are some of those common misperceptions that you have run into, and how do you work to combat those misperceptions?
Yeah, I think it's how to combat them are opportunities like this, and giving people a chance to really hear the stories of the people that are experiencing homelessness, and always lifting up those voices. I think there is this, certainly in the national narrative right now, it is that folks who are homeless are um, not willing to go to treatment, that the reason why they are homeless is because of some type of substance misuse challenge, some type of mental illness. Um, the numbers play out that there are folks who are homeless that struggle with substance misuse, that are folks who, have mental illness and medical conditions. There's also folks who have full-time jobs and can't pay rent. There's folks who have been evicted for no reason of their own, and now they're living in their car. I mean, we housed someone who was, said, well, I need to pick a unit that's close to Amazon because that's where I go to work every day. And right now I'm staying at this campsite because it's close to where my job is. So I think the misperception is that folks, I guess the other one I would say is that folks are just not interested in housing. And again, I think our program has shown that that's not true.
Do you see a potential to scale this up to other people in housing crisis? So, for example, in the chat, it was mentioned folks who have disabilities who are in housing that's inaccessible to them. And while not on the street, they do have a housing crisis.
Yeah, I think that you know, so the city stepped up to take on this challenge. We are partners with um, the county, and it is the county's Office of Homeless Services that oversees the more broad continuum of care when it comes to housing folks who are in shelter and others programs. So we're hopeful that some best practices that we have here can kind of bleed into other places. I will say, there's a number of reasons why we're successful, I think, but the one that sticks out to me and is something that I would recommend every housing program try to adopt, and I think we're open to having conversations about that, is our unit acquisition team. So a lot of times when folks who are low income or homeless, there's a variety of different assistance programs. People receive vouchers for a variety of different reasons to help them with their housing. But the program typically is, here's your voucher. Now you as voucher holder go out into the community and talk to a landlord that's willing to rent to you and willing to look past maybe a past legal system involvement, maybe a past eviction, or just the fact that you're a low income person who has a voucher. And that landlord has all the power in that relationship. And the voucher is a good voucher; it will pay the person's rent, but it's still one person. And beyond all of that, it's one person who's often in crisis. They're sleeping in a tent. They're sleeping in their car. They're in a homeless shelter with their kids, just trying to figure out how to get through the day. And now they have this task of going out and negotiating with a landlord about how to get their voucher accepted and all the paperwork that comes with that. So what our team does is we go out and find those units so that when we come to the site, we're presenting an actual unit to a person. We're not saying, here's your voucher. Now here's a list of people you could call. It's, do you want to live at 345 Main Street? It's a one bedroom unit on the first floor. Here's some pictures. Are you interested? And then if, we apply and you get denied because the landlord still ultimately decides who they're going to rent to, we'll find you another one. And so I think that practice, for that question about accessible housing, I think, like, if those folks have access to the resources to pay the rent, it's about how do we help them find that unit so that all of the burden isn't on this person who is in crisis in the moment, whether they're housing insecure or literally homeless.
How long are you tracking those in housing, and how is long-term housing supported?
So, I mean, we're still new in the fact that, we're not even at the 2 year mark yet. So in terms of the tracking for folks who have exited the program, we're still developing that. But in terms of people in the program, we're keeping track of all services that they've signed up for. We're keeping track of their exits. We're keeping track of if they return to homelessness because they've emerged back in the homeless system, whether that's through our outreach providers or the shelter providers. And I think, I was actually just at a presentation today. We had a grad student from CASE who was working on her MPH. And so she just did a year-long study of our program to look at the results of people in this program and their long-term success. So certainly we're tracking that and trying to make sure we're doing the best we can at that, because I think there's also we want to show that we're housing folks. But I think people that aren't interested in housing, but are interested in education, or interested in healthcare, or interested in workforce development, all of those things we believe come after a person is in housing. So we want to show how this program leads to those types of successes for folks as well.
Liam, you mentioned so many partners and collaborators that you work with to provide the additional wraparound services for those you house. Are there any gaps in services that you are looking to fill right now?
Yeah. So we, I think the biggest challenge, I think, I will answer that question, then also use it as a springboard for another challenge just to share with folks. So, our goal is to house people as quickly as possible. Because I don't believe that any person's situation is made better by being homeless a day longer. So there are certainly resources in our community for people with severe mental health challenges and medical challenges, and maybe ultimately could bridge to those resources. But we want them to get off the street immediately. But we've found that for some of our folks, really intensive community-based mental health supports are something that we're continually trying to add to our team, because our navigators are really meant to kind of walk alongside folks as they stabilize in housing, get connected to documents, get signed up for food stamps and Social Security. But when it comes to kind of making a clinical diagnosis and getting someone that clinical level of care, that's beyond the scope of what we're asking them to do. But some of these folks may need that support. And because they are still in the mindset of being unsheltered, what comes with being unsheltered is not only living in a tent, it's also some trepidation about accessing not only the shelter system, but the medical system, the mental health system in the traditional way. So bringing those services to folks is often the first step. It doesn't mean they won't eventually go to the doctor. They won't eventually go to a counseling appointment, but we need to break down that stigma, break down that trauma, break down that challenge that we have of making that initial contact. So I think that's one area that we're looking to grow. The other thing is just kind of an awareness for folks. I mentioned in the presentation that about 35% of our folks have transferred to a permanent housing voucher. 75% of our folks were eligible for that type of voucher. But the reality is those vouchers there aren't enough of them. And the current proposals around HUD's funding cuts and focus on transitional housing instead of permanent housing will make even less of those available. And so we have funding for our program to continue to house people quickly and get folks off the street and out of that crisis of homelessness. But the broader implications about what that means for people's long-term housing success is very real, and something that is a challenge to not only us, but to anyone working with people that are struggling with homelessness.
Liam, you hit some goals so quickly. So let's look further in the future. What does the long-term success look like, and what support do you need to get there?
Yeah, I think the long-term success is obviously that people remain housed. So we don't want this to be a 12-month, gap in their homeless history, but the pathway to permanent housing. And so I think, we continue to need permanent housing solutions, whether that's affordable housing, subsidized housing, supportive housing. And so we're trying to always build those relationships with those type of providers so that we can transfer folks. I think in terms of what our goals are now is we're not so much onto a number. We're really looking to end unsheltered homelessness. And I think people will continue to experience it, but we're hoping that in time, and we're starting to see that now, is that we can meet folks as they enter homelessness, as opposed to after they've spent the last 9 to 24 months in a tent. And so again, all of those things that they entered homelessness with, slight mental health challenges, substance misuse challenges, whatever it is, none of those things are made better by spending more time outside. So we can get to folks quicker. We can also maybe stop some of those challenges before they get worse, simply because of the trauma that comes with living unsheltered.
Well, Liam, we thank you for all of the work that you and your team do to help the unhoused community in Greater Cleveland. And thank you for the tremendous impact you all are making here.
Thanks so much. Yeah, it's a great team. I'm proud to be a part of it. And thanks for the opportunity to share today.